there, and I'm very, very pleased to introduce Donna Catamero, who is going to go into a bit more detail about supportive care in this time of COVID-19. And this is, as I've been emphasizing, just so important to look at these different aspects. Donna has a tremendous experience. She comes from the Mount Sinai system in New York. And so she really had a lot of hands-on experience, and I'm sure she has a lot of words of wisdom to convey to all of us. So please welcome Donna.
Thank you, Dr. Dury. It's actually a pleasure to speak with everyone this morning. As Dr. Dury said, I'm Donna Catamero at the Mount Sinai Hospital in the heart of New York City. And then last spring, I think we became the center of the epicenter of COVID-19, and literally everyone's lives turned on a dime. Our routines just drastically changed overnight. So I just know that this past year has been very trying for everyone. It's been a year of significant loss and isolation. But despite this, as myeloma patients, we need to carry on. So know that you have a network of friends, family, and your healthcare team to get you through these trying times. And I just want to stress, a recent study from the American Psychological Association reported that over 50% of Americans had either canceled or postponed their health appointments, their medical appointments. So of course, I encourage everyone to continue on with their care, continue with your routine follow-ups and your treatment plan. But because of COVID, in many institutions, we are limiting visitors. So in many instances, you may find yourself attending your appointments or your treatments by yourself. So you want to make sure that you are prepared. Write down your questions and your concerns and even your COVID concerns prior to going. You want to make sure that you can tell your healthcare team any changes since your last visit and any new symptoms, no matter how insignificant they might seem to you, please share them with us. And at the time of your appointment, you'll never hear me say this enough, please bring your mask. But I think a lot of the centers are able to give you a new mask if you forget one. And then with your questions, make sure you ask the most important questions to you first. And then make sure you understand your treatment plan. It's okay to ask your providers to repeat it multiple times. And then you want to make sure you repeat it back to them so there's a mutual understanding. And then because of visitation restrictions, again, you might be alone in that exam room. It's okay to have a loved one or a caregiver on the phone to have that second set of ears. And then when you're at home, try to stay healthy, take care of yourself. Over 40% of Americans during this pandemic have reported significant weight gain. So that's over 25 pounds in a year. And another over 60% of Americans have reported some type of sleep disturbances during this pandemic. So, really you want to communicate with your healthcare team in between visits and see how we can help you get through this. So telehealth visits, we're utilizing them more and more given this day and age, and they're really equivalent to an in-person visit. Though there are some tips when you are doing, if you want to participate using a telehealth visit. First, you want to make sure that you have the appropriate technology, whether that be an iPad, smartphone, or a laptop. You want to make sure that you have a web camera so you can, communicate and see each other. You want to make sure that you plan ahead. Make sure that you know how to log on to your appointment and what time you should be doing that. You want to make sure that you're in a quiet, well-lit place with good Wi-Fi. You do not want to be in your car speeding down the highway. That is a big, big no-no. And then finally, you want to be prepared for your appointment. So prior to your telehealth visit, you should be getting any necessary lab work so that your visit can be fairly predictable. So this slide just shows, on a scale of 1 to 10, how risky is our activities. And so, what makes an activity risky? So it depends on many factors, and you have to ask, in your community, in your setting, in your state, is COVID-19 spreading? So it's important to really be up to date on the positivity rate in your area, and then ask yourself, will I be in close contact with someone who is sick or not wearing a mask? Am I myself at high risk for developing severe illness, or maybe someone that I live with? And then will you be sharing items or equipment during the activity? And then what makes an activity safe? So can you maintain that 6 feet of social distancing? Will this activity be held outdoors versus indoors? And then will people be wearing masks? So that you won't hear me say that enough. Masks are important. They prevent disease and serious illness. So I think we all know this. The best way to prevent illness is to avoid it. So I think we all know that COVID by now is spread through respiratory droplets, which are produced by coughing, sneezing, and talking. And then just things to keep in mind, when we're yelling or talking loudly or even singing, there are more droplets produced. So that 6 feet of social distancing may need to be spread out even further with those types of activities. And just know that droplets can land in the mouth and the nose as well as the eyes. I think we're all aware that COVID-19 can be spread by those who are not exhibiting symptoms. So just keep that in mind. So reduce your risk. And these are common sense rules. So back at the peak of the pandemic in New York City, I was redeployed in infectious disease. And our morning mantra was, wash your hands with soap and water. That really is the best way to wash your hands. But of course, we don't always have access to a sink and soap. So hand sanitizer is 100% appropriate. Just make sure that it's at least 60% alcohol based. Of course, maintain social distancing. Wear a mask, wear a mask, wear a mask. I don't care if the people around you aren't, just please wear a mask. We know that they work. And prevent other illnesses. So please be up to date with your seasonal flu and your pneumonia, because the last thing you want is to have COVID-19 on top of a seasonal flu or a pneumonia. You want to clean and disinfect high-touch surfaces, and of course, try to avoid travel on planes and trains, and definitely cruises. So masks. So you'll hear me talk about this a lot. You want to choose an appropriate mask, so something that's breathable, at least 2 layers, preferably 3 layers. And you want to make sure it covers your, completely covers your nose and your mouth, and has a nice snug fit on the side of the mouth, on the side of the face. What makes a bad mask? So those masks that are not made from those breathable materials, they're making these masks now that are vinyl, so that you can see somebody's face. Although the intentions are good, vinyl is the worst thing to breathe through. Next are these masks with these exhalation valves, and I like to refer to these masks as selfish masks, because it's actually your droplets are escaping and could potentially affect others. So these really aren't great masks for stopping the spread. And then finally, N95 masks should truly be reserved for healthcare workers. A good alternative to an N95 mask is a KN95 mask, which are very similar. And they're masks made from Asia and can be readily purchased on sites like Amazon, which I think they are good masks. Just be cautious with neck gaiters. I really don't think they're effective at all. They're typically only 1 layer of material, and they don't provide that snug fit around the face. If you do like neck gaiters, I would recommend folding them, so at least you have 2 layers of protection. The next is face shields. So the primary purpose of a face shield was to provide eye protection. It is really not to be used in exchange for a mask. So you really should be using a mask and a face shield to provide you with eye protection and eye protection only. And another thing we're seeing more and more is people are wearing double masks. The purpose of a double mask is it provides a better fit around the face, especially now that we have more contagion variants circulating across the country. So it gives you a little more protection. So the proper way to wear two masks is to have the disposable mask underneath the cloth mask. And just please remember to frequently wash your cloth mask, because I know people are wearing the same cloth mask day after day after day and not washing them, and that can be kind of dirty. So just make sure you do frequently wash your cloth mask. So wear your mask and wear it correctly. So again, we want to cover the nose and the mouth. There are so many times I see people with their nose peeking out of their mouth, out of their mask, and it's essentially like not wearing a mask at all. It's providing you no protection, and it's not providing protection to others. So please, when you do wear a mask, cover your nose and cover your mouth. So I want to end about stress during this pandemic, and I know Dr. Dury touched on this. We know that it's been a very stressful time this year, and 50% of Americans have actually reported that their mental health has declined over the past year. So in addition to, significant weight gain that we're seeing and sleep disturbances, more and more Americans are reporting an increase in alcohol and other substance use. So it's important for us to take care of ourselves. So identify your bad habits, your bad behavior, and try to change them. And I know that can be easier said than done. I think this past year, many of us have stayed indoors, sat on our couches. I think probably Netflix was probably the best thing since sliced bread. So, but the weather is getting better. There are more opportunities to do activities outside, go take a walk, go outside and do some safe activities. And then finally, isolation has been a big issue with patients and people in general. So connect with others. And I think Dr. Dury brought up the point of support groups. FaceTime is better than no time, and really connecting with one another can really help us through. And I'll just end by saying, the light is getting brighter. We're almost at the other end, or the other end of the tunnel, the proverbial tunnel. So I think life will slowly get back to normal, hopefully by the end of the year. So, and with that, I'll end.
Just try to pick up on some of those. Is it necessary to wear a face shield if you wear glasses? That's one sitting there. Do you want to answer that one, Donna?
Yeah, so I know it's very difficult for people who wear glasses, I myself, and they sell face shields now that go nicely over glasses, but I don't think it's something that we routinely would wear eye protection. It's really for healthcare providers when they have close contact with sick patients.
Yeah, right. There's a tip here. A drop of liquid soap spread on the inside of lenses prevents fogging. Oh, that's a good tip if it's true. I don't know.
Yes, it actually works. It works.
Does that work?
It works. Trust me.
All right. Well, that's a good one. That's a new one for me. So it says not all. This I'm aware of. Not all K95 masks are created alike. Some are virtually useless. Yeah, I think you touched on that. I mean, some real N95 masks, you can get them online now. I don't know what suggestions that you have, Donna, in terms of sourcing to get the best mask.
So I was just fortunate that I actually have colleagues that live in Korea, in Japan. I found that the Korean and Japanese KN95 masks are of good quality. So I would look to see if they were made in those two countries.
Yeah, I would agree with that, actually, yes. Yes. Now, this is an interesting one, actually. Is it safe to stay in a motel? I mean, we're telling people that they shouldn't travel in planes or trains or go on a cruise. But if you're driving and trying to take a little trip locally, how about staying in a motel? What do you think about that?
I don't disagree with it. I think traveling locally within your tri-state area, I actually, when I do travel, I bring my own wipes, and I do wipe down anything that's highly touched, so the remote control, etc. But again, you are isolating yourself in your family bubble. I think it's a relatively safe activity. But I do that extra spot cleaning because I'm neurotic.
No, I think maybe I'm not so neurotic. I think it's probably a good idea to do that spot cleaning. Yes. Now, this is a practical thing that has affected many people, especially women. If both you and your hairdresser are wearing a mask, is getting your hair cut and colored safe with a 90-minute appointment? What do you think about that?
So underneath this brown hair is actually white hair. So there was, this is such a touchy subject because, yes, as a woman, I know. There was, I forgot what state it was, maybe Michigan, where they opened up the salons a little bit earlier, and two of the hairstylists were tested positive for COVID. However, none of their clients tested positive. They were both wearing masks, but just know it is on a higher risk level. But it's like I can't practice what I preach because, of course, look at me. I'd be fully white-haired if I didn't dye my hair. But just common sense rules. Both should be wearing face masks, and I'll leave it at that.
Right.
You can fully disagree with me, Dr. Dury, but no. It's hard being a woman.
Actually, we're talking about the stress and the problems, and I think that being able to go and get your hair colored, I think, is a significant stress reducer, and I think that is of substantial value in itself. That's my personal opinion. Now, there's also a question here about ventilation in hotels. I think that this is going to be an increasingly important issue as things start to open up. I think that paying attention to ventilation is a concern, and I'm already seeing that there are some hotels and motels where renovations have been already conducted to try to improve the ventilation. And there's even a system for a company, actually, that is kind of grading buildings and hotels related to safeness, including ventilation. Are you aware of that, where there's more of a grading system coming into play for larger buildings or hotels? Do you see that in New York at all?
I actually had to travel up to Boston, and the big chain hotels are putting these air purified ventilation into each room. So there's a unit that they put into each room. So I would call ahead to see, the hotel that you're thinking of staying, to see what kind of precautions they put in place. But I am seeing the larger chain hotels making these adaptations.
Right. So then we talked about getting your hair done. Then it says here, my husband and I have both been vaccinated, and now he wants to start to go back to the gym. Now, that's good. However, if everyone's not wearing a mask, how about that? I think that gyms can be problematic. Fortunately, out here in California, a number of gyms have been using outside spaces, and so that has been and is becoming rather popular, where people are going to the gym but outside in a sort of an open, slightly tented area. But what do you think about that, Donna?
Yeah, so New York, we do get 4 seasons. So the summer and fall, there were a lot of outdoor classes where they spread people out. Where I am in the metro area, still we have a mask mandate, and you can't work out without a mask. What we've been telling our patients is, to figure out when the least, like the lowest volume of people going into the gym. And right. When it's not so busy, maybe that would be a good opportunity. And again, face mask all the time. I know it's not the most comfortable when you work out, but it's for everyone's safety.
Right, right. Look, we have a lot of questions about masks, and I just have to say I fully agree with you, Donna. I think that despite vaccination, despite all these different things, it's still important to wear a mask until the level of community infection is definitely lower. Yes. Apparently, the CDC has a list of the best masks. I think that is true. I've seen that. Yes. So that can be checked out as a source of information. That is correct. Yes. Yeah. There's a question. My sister had COVID. Can I see her freely? This actually is a tricky question. I mean, I've had that question from a number of patients where family members have actually had COVID, and then maybe some weeks later, question about getting together with that family member. Have you encountered that quite a bit?
Yeah, and I saw a question too come through, like, can I hug my grandchildren? And these are all heartbreaking questions. The CDC is recommending, people who are both vaccinated can conjugate in small groups. Just be aware that there are variants, especially in Florida, that they both have the UK variant and the South African variant that are more contagious. And that's why you see more and more people double masking. I don't think we're out of the woods just yet. So I'm hoping by, early fall or even sooner we'll reach herd immunity and things can get back to more of a normal life.
Yeah, I really second that. I think that with the dramatic speeding up of the vaccination, with the release of more vaccine, more and more people getting vaccinated, I think that this is really encouraging, and I think that it will steadily reduce the level of community infection and reduce the risk of generally being out and about. And so I'm definitely, for the first time, a little bit more optimistic. I will just say here in Los Angeles, we have been in lockdown, it seems like forever. But just yesterday, some of the restaurants opened at 25% capacity, and which I think is, with care, is probably safe. But I mean, we're sensing some elements of returning toward some degree of normal. So there is some light coming. So that's good news. Before we finish up in this segment, we have our panelists, I think, available. I don't know if you have any strong words of wisdom about COVID-19 from your experience that you would like to give us at this point. Yelak, from a patient perspective, or Paul or Rafat, are there any strong points you'd like to make about the COVID pandemic? No? That's fine.
Sorry, guys, I don't know if you can hear me.
Yes.
Sorry, I don't know if you can hear me, guys. It's Paul here.
Yeah. Yes, Paul.
Oh, yeah. Yeah. No, I was just going to say, I think Donna captured it very well. I think the challenge for COVID-19, you addressed it very comprehensively. I think the issues of precautions and being careful are essential, because what we're realizing is the degree of protection for all patients with hematologic cancers is a concern from the vaccine standpoint, but also that patients with hematologic cancers are vulnerable to COVID-19. So I think we need to be obviously optimistic, but also be very careful. All my patients are being vaccinated. Some patients are seeing antibody responses, some are not. Good news is that you have innate immunity from T cells that can protect you. But again, we're learning an awful lot about how much protection there is, how much there isn't. So I think it's a very dynamic area where we're learning more. The good news is, though, that the therapeutics in COVID-19 are improving dramatically as well. So I think to echo Donna, there's a strong message of hope, but I think to be very careful. And like you, Brian, I'm concerned about the variants and what they mean.
Yeah, absolutely. So I think that the variants obviously spread much more easily, and so I think that reinforce the point that you've made, Paul, which is that have an excellent antibody response, others maybe not so much. And so it is still quite important to maintain the precautions, to wear masks. I actually like the idea of the double masks, which are actually quite comfortable, so that that can really reduce the risk of spread, especially with these new variants. And so I do think that we're going to be seeing mask use for quite a bit of time for myeloma patients, just to maintain this level of precaution. Okay, so I think that a lot of great questions in this opening session, and so I hope that it's been interesting and helpful and educational for our listeners and participants.